Breast cancer rehabilitation. I've included a photo of a breast scar from one of the ladies that visited this week, just so it gives you an idea of what I'm talking about. So in this case, this lady is about 2 years down the track and she had lots of trouble with her breast scar. It was very active, so it was painful, it was thick, and it was attached to the rib cage so that there was not much movement in the tissue. We didn't actually take a photo of this scar before we started, so this is what it looks like 2 years down the track. So you can see that the breast scar is not really indented, and it's soft around the outside edges. But when this scar was active and earlier in the piece, the line was indented. It was quite thick on the edges, surrounding edges, like about a good inch around the outside. You could see that it was quite swollen or thick, and it was certainly very painful to touch. So now the scar is softer, it's stretchier, and there's less attachment to the underside surface. So by treating the scar, what we're doing is actually kicking in a healing response. So by using acupressure, kinesio tape, or low-level laser on a regular basis, then the tissue is being asked to heal again. And so the usual healing time is like about 4 weeks, and then the healing time ceases. So by using these treatment techniques, we've kicked in that healing time again. Now we're still working on this particular scar for this lady, and in this instance it has taken a long time. That's for this lady, and every lady is different. The length of time it takes for the scar to heal is purely individual. So for some women it might take a couple of months, for others it might take much longer. I always find the information from research to give some guide about what's going on. And there is research that says that they found active chemicals which are precursors to scar tissue up to 2 years after the surgery. So the body is really preset with chemicals to cause scar tissue to be active. And the time frame can be 2 years, and for some people less and some people more. So I snuck out of work and I'm down on the Brisbane River. But I wanted to remind you that if this has been helpful to you, talking about the changes that occur to women after breast cancer, then please subscribe. That means that you'll be able to find this site again. If you've got some comments, or if you'd like a topic to be covered, then leave a comment below, and we'll be able to talk about those things that happen to some women after breast cancer, and more importantly, talk about the rehabilitation options.